With millions affected by autism,
No visual contact. She wasn't speaking. I didn't know how to help her.
could an experimental treatment be the breakthrough parents have been desperate for?
The second day of treatment were the first words I had heard from my daughter.
And why others aren't so sure.
It hasn't even been submitted to the FDA.
Then, can your cup of joe cause migraines?
Raise the risk by 161%.
Plus, Justin Bieber's anxiety cure.
He's got the Bieber fever!
That's today.
An autism diagnosis can be devastating. And for one single mom, it has affected every single aspect of her life.
The first time I realized something wasn't right was in infancy. I noticed Noam wasn't making eye contact. He was delayed, sitting up, crawling, walking. So I knew something wasn't right. Noam was diagnosed with autism at 26 months old. Life felt really bleak for a while. Being a mom with two sons is amazing. Noam is 12 and Asher is 9.
My brother, he has special needs. He has autism, which means he can't talk, he can't control going to the bathroom. Sometimes he has tantrums if it's really severe.
I don't really leave the house much with him because I don't want to deal with that in public. I know he must feel so much frustration in there, and I just want him to be able to express it.
Because he has autism, it's not like we can play board games together or anything like that, but we're still brothers. He likes to play on the trampoline a lot, and I play on the trampoline with him.
Being a single mom is a big juggling act. It takes a high level of strength and mental health to get through each day, and not really having any mode of communication is the toughest part.
She does so much. She's a great mom. I love her very much.
We still haven't found the intervention that's going to make the difference for him, but we do have this just fervent belief that it's out there. I would love to hear him say, "I love you, Mom."
We have Leah joining us today, and thank you for being here and sharing your story. And off the bat, I'm going to say it is just so obvious how much love you have for your kids. And what has been the most challenging part, though, thus far?
I would say the most challenging part is just the juggling act. Being a single parent of 2 boys, sometimes I have to remember to give them both attention. Asher can fall through the cracks, so we have to make an effort to have quality time with each of them as opposed to always being able to do things as a family unit.
And what type of support system do you have?
Well, I've been very blessed to have attracted this incredible nanny who is a godsend. I call him my own Mother Teresa because I don't know what I would do without him. He loves the boys like his own. He's become a father figure, and we're so blessed to have his support and his help.
What's his name?
Alan.
Shout out to Alan. Those pictures are beautiful. What hope do you have for Noam's future? What would that look like in the best possible way?
Well, I'm a very spiritual person, so I like to believe in, the sky being the limit, and I'd love to see him leading a completely typical life. But for sure, having speech would be a dream come true. I think that's a big source of frustration for him is that he can't communicate his preferences. So just to hear him say what his wants, his needs, his desires are, I believe that's just a God-given right for all of us to have that gift of expression, and I want that so badly for him.
And I think anyone watching our show realizes that every child with autism presents differently, and how you treat them and how they progress, it's different. So on our show, we're always thinking about new possibilities. And I want to introduce everyone to someone in our audience, Dr. Spencer Miller, because Dr. Miller, can you tell us a little bit about a unique treatment that you offer that may have some hope, and certainly for a mom like Leah who feels out of options, and it's called MeRT.
Right.
Can you tell me what that is and how it works?
Yes, so MeRT is an emerging technology. It is experimental in some regards that actually tries to reprogram abnormal electrical signals in the brain. We measure the electrical signals using a quantitative EEG, so it's a very simple, common use practice in neurology, where we put a cap on the head and look at where abnormal signals are coming from. We then turn around with that data and use these electrical signals to send back in the brain and try to attempt to re-attenuate or to modulate these brain signals. And the changes that we measure on these repeated EEGs should correlate to behavioral changes.
And the child looked very comfortable. Didn't look like there was any pain associated with the procedure at all.
Non-invasive, no medication involved with it, no pain. Sometimes you can feel a little bit of an electrical pulse, but it's a mild tap on the forehead.
How many treatments typically do you need to administer, and how soon do you see results, and what have the results been?
Usually within the first couple of days or weeks, you can start to see some benefits, some changes in their behavior. In general, we recommend about 4 weeks to 6 weeks of treatment. The treatments are every day, 30 minutes or so. So they come to the clinic, get the stimulation, and go about their daily business. So some children will have significant behavioral changes very early. Some will take longer to get results. You know, this is all new. And like I said, it's kind of evolving over time.
In your experience, what kind of results are you getting in terms of the number of kids who are showing a benefit, a change in behavior? Do you have a number or percentage?
So I don't have a percentage with me, but for the patients that I have seen changes in behavior, it's typically just exactly what you're asking for. Language in general is one of those things that seems to really be commonly changed. The way that they interact with their environment, their ability to change from, you know, we have to go to a doctor's appointment at 7 today instead of 8, so we're gonna have to change our schedule so there's not a meltdown in your car trying to go to a doctor's appointment. The other thing that we hear a lot of parents talk about is the presence, which, you know, is not really a medical term, but you know what I'm talking about. If your child is not there with you, even though they're sitting right in front of you, you're talking to them, there's just this absence. And so to be able to feel like your child is with you and listening or understanding you, so we hear parents describe those type of behavioral improvements.
And what potential side effects do you discuss with patients when you're talking about this procedure?
So the one that is the most feared really is not that big of a deal. However, we have to discuss it. It's about a 1 in 150,000 chance of having a seizure. It's self-limited. A seizure is abnormal signals of the brain. We're reprogramming the brain, so you can imagine that that's a potential. But the seizure that would occur would be self-limited. You stop the stimulation, the seizure goes away. And I don't know of any cases where treatment has been administered and caused a seizure that then results in epilepsy or the epilepsy syndrome, where you have continuous seizures throughout your life. So I don't know of that to be the case.
So, to me, really exciting. Acknowledging, however, that it is still experimental, and right now we have clinical neuroscientist Dr. Lindsay Oberman joining us today via Skype to weigh in. And you've heard our discussion, and I think you're also well aware of how frustrating it can be for parents trying to find anything that might help. What's your take, as we've been discussing this, in terms of treating autism with MeRT, and where do you stand on the issue?
So I've been using TMS and other brain stimulation tools. MeRT is a form of TMS, transcranial magnetic stimulation. I've been doing this for about 15 years. And in the individuals with autism, both adults and children. And TMS and MeRT uses a very large magnetic field, where we know that magnetic field can modulate brain networks and brain circuits. The question remains as to what brain circuit do we want to modulate, and in what way that will lead to a positive change in terms of behaviors. So we want to be improving language. We want to be improving things like reducing the meltdowns or improving social interaction or presence, as he mentioned. But what types of protocols with types of brain stimulation do we need to put in to do that is still unknown. So the concern as a research field that we have is that there's only been one single, very small scale clinical trial in individuals with autism. It was adults, in fact, that showed very small improvements over a placebo control condition where there was no magnetic field at all. And so the concern we have is that there's just not this scientific evidence base out yet. The FDA has not approved it. It hasn't even been submitted to the FDA because the trials have just simply not been conducted. So we are hoping that those types of trials can be done and will be done. But until then, we are just simply not recommending that it be used clinically.
And I know it's still experimental and you're still learning, but just based on the experiences you've had, is there a way to tell which autistic children are more likely to respond to treatment?
No, so there are metrics that are trying to be identified, whether it be EEG or MRI or other brain-based metrics, to try to say this person will be most likely a responder to TMS or drugs or behavioral therapy across a number of disorders, depression, anxiety, other disorders as well. And that metric has, again, unfortunately not been identified as of yet.
I think this is such an important topic, one we will continue to discuss. Let's take a break.